today I want to talk a little bit about the pelvic floor. So this right here is your pelvis. So we can see some lumbar vertebrae, L4 and L5. And then we can see the two hip bones, which make up your pelvic girdle. So these are called your ilia. And then in through here, you can see your sacrum and then your tailbone. So we're gonna look at the superficial layer of the pelvic floor first. So this is called the superficial triangle. So there's a lot of layers of the pelvic floor. The pelvic floor is considered everything from the skin from the outside all the way until the peritoneal lining that lines your abdominal and pelvic cavities. So we're gonna be talking mostly about the skeletal muscle layers. So this first layer is called your superficial triangle. So we can see distinctly three different muscles here. So we have one muscle that runs from your pubic bone to your ischial tuberosity, which is your sit bone. So this muscle here, which is on both sides, is called your ischiocavernosus. This muscle is the same in males. This is obviously a female model. The next muscle that we have runs from the pubic bone down to this little area called your perineal body. So this is the space between your vaginal opening and your anus. Men have it as well. And this muscle runs a little bit more inside of this other muscle. So this is called your bulbocavernosus in females and bulbospongiosus in males. But it's the same muscle. And then we have this muscle that goes horizontal. So from the ischial tuberosity, that sit bone, to that perineal body, that's called your superficial transverse perineal muscle. So like I said, this little area right here is called your perineal body. And all these muscles are attaching right here. So this is actually where your center of gravity is. Sometimes it's also stated as around S2. You can see your external anal sphincter here, and then you can also see this deeper layer, which we'll look at from the inside of the pelvic girdle in 1 second. This is called your levator ani, which is just a group of muscles. So this superficial layer of skeletal muscle is for sexual arousal and urinary continence. If we take a look at the inside of the pelvis, like I said, this group of muscles is called your levator ani. And so you have a lot of different muscles. You can also see some muscles that belong to the hip, like your obturator internus and your piriformis. So this layer is more in charge of holding up your pelvic organs and also working with the rest of your core, so your deep abdominal wall, your deep back muscles, to generate what's called intra-abdominal pressure. And the purpose of that is to provide stability to your spine. So those are the two layers of the pelvic floor that are located in your pelvic girdle.